Hello, this is Dr. Eva Boldridge, and I'm going to give you some of the tips that I have for when you're trying to start your digital workflow with doing dentures. One of the most important things is to remember the fundamentals that we all learned in dental school about dentures. Impressions of the edentulous ridge is still just as important as it was in analog. You just have to be a little bit more creative in capturing it. Sometimes I use intraoral scans, sometimes I take a regular alginate impression, or if you prefer PBS, and you can scan that. What's most important is that you capture as much of the alveolar ridge as possible. When you have those patients who really don't have much of a ridge, it makes it a little bit more difficult to get an intraoral scan. So I recommend doing an impression and either pouring that up or just taking the scan and sending that. The key when it comes to sending scans is that you have to give your laboratory something that can give a relationship between the upper and lower jaw. That's the reason why we did the occlusal rims, was to make sure we could have an orientation for the upper and lower jaw to set teeth. With scanning, you can do a mush bite. I use the Ivoclar centric tray. That works pretty good for me actually, once you learn how to use it. When you're taking records, you not only need to just take them analog, taking them and then scanning them, it's also highly recommended that you take a photograph of the patient with the centric tray so that you can have a photograph for your designer or your laboratory so that you can get a relationship between the tray and the patient's interpupillary lines. Now, I will also say that most of what I'm saying is coming from using the 3Shape removable module. I know that a lot of people use exocad, so I can't speak for exocad, but the removable module is what I use, and I've been using it for over 5 years now. If you want to still do occlusal rims, there's nothing wrong with that. You can make them very quick. You can take a very quick impression with fast set alginate, pour it up in snapstone, and then make occlusal rims on there, and then get a good vertical. Once you have that, you can always wash those occlusal rims with a PBS and send that to the laboratory. That will have the impression of the edentulous ridge. It will also have the relationships, and it will also have your midline, your canine marked areas. So there's many ways to do it. I have a 3Shape, so I do pretty well with it. I still had to learn how to properly scan. When I take impressions on an edentulous ridge, I usually start with doing the occlusal, the top of the edentulous ridge. Then I go on the lingual first, and then follow it with going on the facial. Those are usually the most ideal, is occlusal lingual facial or occlusal facial lingual. If you have any questions, it's really important to talk to whoever is designing at your laboratory so that you can get what information they need to make sure they give you a good try-in. Almost all of my try-ins at this point are 3D try-ins. Most of the time I have them all just one shade. Most patients really don't mind it. If they want to, I can add some pink just around the gingival margins so that they can try it out. But most patients are really, really happy with just the try-in. And if you have to move teeth, that's a little bit more difficult. What I have found that with the try-ins, I usually mark with a Sharpie, the midline, then I cut down the tooth, or you can add some acrylic or composite to build an area up. When it comes to relaying this information digitally, you sometimes have to not just do a mark with a Sharpie, but you have to use a burr so that the laboratory can actually see on your scan where these lines are, because a lot of the times the visual Sharpie mark won't show up on the scans. At least I have found that when I import things into my program. So if you need to move a margin down, or you need to bring the teeth and make them look longer, I do little lines to give myself a little note of moving the teeth down. You can cut the teeth down whatever way you want to occlusally, but if you need to extend them, I usually mark with a burr how far I need to go down. At this point, once you have your try-in, all you have to do is make sure you get everything the way you want it to be, enough information for your laboratory so that they can import these files, and then you have a delivery. I have heard some people complain about the dentures not having much suction. I have not had that problem. I would say in most situations you need to talk to your laboratory technician or whoever's designing and make sure they're not blocking out too much so that it's not, having good adhesion to the tissue. That would probably be my biggest thing. If the patient has huge undercuts or huge tori or lingual tori, you have to block out for that. So you may have to think about surgical intervention to remove those large tori. I hope this information was helpful. If you have any more questions, please write it in the comment section below. Thank you very much and have a good day.